Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Thank you for joining us here today. Our guest in studio is Dr. Kimberly Cress, psychiatrist and founder of the TMS Serenity Center in Sugarland, Texas. She's joined us here in studio on Health Professional Radio to talk about some of the things that she's observed in her TMS clinical practice and what patients should consider when they're choosing a TMS treatment. Welcome to the program, Dr. Cress.
Thank you, Neal.
Thank you. Well, first of all, tell our listeners what TMS is.
So TMS, or Transcranial Magnetic Stimulation, is a neuromodulation treatment. So we're using an MRI strength magnet in order to help the treatment of depression by facilitating the release of neurotransmitters like serotonin, norepinephrine, dopamine, those neurotransmitters that are provided artificially through medication. We can help facilitate their release through the treatment without the risk of systemic side effects that can occur with taking medication.
What was it that got you interested in TMS? As a psychiatrist, have you always been interested in, alternatives to psychiatric meds?
It's a great question. I started my practice in 2000, and in 2010, prior to that, I'd been following the research in regards to TMS, and TMS had been FDA cleared in 2008. But I had a particular individual that came in where she had been sensitive to side effects with every medication, no matter if I gave her a liquid preparation at a lower dosage, pieces of pills, different medications, different mechanisms. She was not able to tolerate the treatment. And we had a conversation that the next step was to consider TMS or ECT or VNS, vagal nerve stimulation. And her comment back to me was, you're not shocking me, you're not implanting anything in my chest, let's look into the magnets. And so as I did additional research specific for her care, it struck me how, I have other individuals in my practice that despite the medications or medication regimen that I have them on, that they were still really struggling with depression. And TMS could be an important treatment modality to help offer them, to help them finally get some relief from their depression that they were still struggling with, that it wasn't just going to be specific for this individual. So that's when I elected to incorporate TMS and the NeuroStar treatment into my practice, and I now actually have 2 NeuroStar chairs.
Mm-hmm. When we're talking healthcare and treatments and recovery and whatnot, we hear buzzwords throughout the industry. We hear clinically proven and evidence-based. What are some of the clinically proven outcomes? Because as consumers, especially when we're looking to maybe go off the beaten path, as it were, we're looking for some hard evidence to let us know that what we're considering isn't just some fly-by-night or sham treatment, especially when it comes to something as severe as depression.
Absolutely. The first data comes in from the data that was collected by Neuronetics for initial FDA approval of TMS in 2008, which found individuals with major depression off of any antidepressant medication, they received, 1 and 2 went into response, and 1 and 3 went into remission. As the years have passed, additional data has supported, and that includes a study that was done by the NIMH, which actually replicated the findings of that initial trial done by Neuronetics. We at the TMS Serenity Center have been as well monitoring to see how individuals do over the course of time, and having them complete various rating scales, whether it's a Beck depression, Beck anxiety, the PHQ-9. And in fact, this past May presented our data at the American Psychiatric Association, and of 123 patients with major depression, we had a 76% response rate and a 72% remission rate. I have been able to help individuals in ways I've never been able to help them with another medication trial with the use of TMS. So more commonly the individuals who I'm treating, especially in the beginning with TMS, were those that I had been treating for years with various medications, and still they were struggling with depression. And TMS has been able to help them get their lives back in ways that they never had it before.
Are there differences in TMS when the cause of the person's depression is identified? And is it even essential to identify the cause of a person's depression in order to administer TMS effectively?
Well, that can be a very complex question in the sense that we certainly, in any time in evaluating an individual, we have to rule out any other type of comorbidities. For example, do they have a thyroid condition that could play a role in their mood disorder? And so that needs to be effectively treated. Is there a medication that they're taking that can, as a side effect, could, fuel their depression? So we certainly want to effectively evaluate individuals to make sure that any of those comorbidities are not there. Do they have substance abuse related issues? We know alcohol is a depressant. Are they abusing alcohol? That can have an impact on their mood.
If a person is considering TMS, transcranial stimulation, what types of questions should they ask? I mean, this is pretty new technology, recently approved by the FDA. What types of questions would I want to ask my doctor or you?
I think it would be asking the question, why is this the right next step for me? Why would I want to consider it? To me, anybody who I would consider TMS treatment would be somebody whom has struggled with depression despite various medication trials and or can't tolerate the antidepressant medications due to their side effects. That would be somebody that would be a likely candidate who would benefit from TMS treatment. The other thing that's important to think about, and certainly research has proven, that if we have individuals who are struggling with major depression, the longer they go with the depression and not getting to the point of remission, it's going to be harder to finally help them get some relief from the depression. And so the sooner we effectively treat their depression in the course of the illness, the more effectiveness we are going to have. And as we see, more and more individuals struggling with depression, we have 16.1 million individuals in America struggling with major depression. This is an illness that's having an impact on clearly millions of individuals, and we need to treat, but treat effectively. And, we have, many millions of individuals who are still struggling, and not getting effective treatment with medication.
Have you found in your experience or in your practice there in Sugarland that sometimes a patient goes into remission and is non-responsive to additional TMS treatments, but has become responsive to medication, or vice versa?
Clinically, I have not seen an individual who was not responsive to TMS then be responsive to a medication trial. I have had a rare situation where I've had an individual where they didn't respond to TMS, but they did respond to ECT. But I've also had just the reverse. I have several individuals in my practice who received ECT and or have had vagal nerve stimulation and still struggling with depression, and TMS got them out of the darkness of depression. One of the first patients I treated, Gloria, had ECT in her past. And I love her quote, if you don't mind me saying that, because I think her expression of how she responded to the TMS is can give more information than I ever can. And Gloria goes on to say, I've had depression for a number of years and have taken many medications. However, no depression treatments have had the impact that TMS has had. I no longer wake up in the morning wondering if I was able to push myself enough to get one thing done, or will it be another day of languishing around the house. I am no longer a person just surviving my depression. I am a happy person with the motivation to make a life for myself. That's what TMS has given to me.
Now, where can our listeners go and get more information about TMS therapy, or possibly find a NeuroStar TMS treatment location near them?
So neurostar.com, at their website, you can find a provider in your area closest to you.
And as far as the TMS Serenity Center?
TMSSerenityCenter.com.
Great. It's been great having you here in studio today, Dr. Cress.
Thank you, Neal.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.